If you've got a senior pet at home, you know that incredible, quiet bond that just gets deeper and deeper every year. But you probably also know that little nod of worry you get when you start to notice they're changing. Is it just them getting older, or could it be something more? All right, let's get into it and figure this out together. You know, it's amazing. Thanks to great care and food, our cats and dogs are living way longer than they used to. And that's such a gift, right? More time with them. But with that extra time comes the reality of aging. And just like people, their minds can start to feel the years too. You might catch a glimpse of confusion in their eyes or see a new habit that you just can't explain. Trust me, you're not imagining things. So this is it. This is the big question that every single person with an older pet asks themselves. How in the world do you tell the difference between a normal slowdown and something that might be a real cognitive issue? Let's break down what to look for. Okay, take a look at this, because the difference can be really subtle. On the left, you've got normal aging. Yeah, they're going to sleep more, they might not hear or see as well, maybe they're a little slower on your walks. Totally normal. But then look at the right side. This is where it's different. We're not just talking about sleeping more. We're talking about their whole schedule being flipped upside down, pacing all night and then out cold all day. It's not just being slow, it's getting lost in a house they've known for years. The key thing to notice here is the type of change and just how much it's affecting them. So when those behaviors we just talked about start to show up together and form a pattern, that's actually have a name for it. This isn't just a vague idea of your pet getting old. No, this is a real, recognized medical condition. And believe me, just giving it a name is the first huge step toward helping them. The official term is cognitive dysfunction syndrome, or CDS for short. And honestly, the easiest way to wrap your head around it is to think of it like Alzheimer's disease, but for pets. It's a condition that gets worse over time, caused by physical changes in the brain that mess with their memory, their ability to learn new things, and just their general awareness of what's going on around them. It's not just old age, it's a specific disorder. And if you're seeing some of these signs, I want you to know you are so far from being alone. I mean, just look at these numbers. For cats between 11 and 14, almost a third show signs of CDS. For cats over 15, that jumps to a whopping 50%. That's 1 in 2. And for dogs that are 15 or 16, it's almost 70%. This is incredibly common, but it often gets missed because so many of us just write it off as our pet just getting old. Okay, so we know it's a real thing, but how do you, at home, actually keep track of it all? Well, luckily, veterinarians have come up with a really smart framework to help us pinpoint the exact signs. It gives you a much clearer picture of what's happening. This is called the DSHA acronym, and it is such a useful checklist. Let's walk through it. D is for disorientation. This is that classic getting stuck in a corner or just staring at a wall for no reason. I is for interactions. Maybe your super cuddly dog doesn't seem to want pets anymore or doesn't even get up to greet you. S is for that sleep-wake cycle we talked about, all mixed up. H is for house soiling, a perfectly house-trained pet suddenly having accidents inside. The first A stands for activity changes, like just wandering around with no purpose or not wanting to play with their favorite toy. And the final A is for anxiety. We're talking new fears, new phobias, maybe they can't stand to be alone anymore. If you're checking boxes in a few of these categories, that's a huge sign it's time to call the vet. And this quote just nails it, doesn't it? It shows how this affects the entire family. Of all those signs on the checklist, vets say the one that almost always gets people to finally come in is the messed up sleep schedule. I mean, when your cat is howling at 3 in the morning or your dog is pacing back and forth all night long, nobody is sleeping. It is incredibly stressful, and it is totally okay to feel that way. Right. So you've been watching, you've been taking notes, and you just know in your gut that something's off. The next step is getting a real, clear answer from a professional. So how does a vet actually figure out if it's CDS? So here's the most important thing to understand. There's no single test for CDS. There's no blood test that just flashes positive. Instead, it's what's called a diagnosis of exclusion. You have to think of your vet as a detective. Their first job is to cross all the other possible suspects off the list. And that detective work follows a pretty clear path. It always starts with a really good physical and neurological exam. Then they'll run some blood work and check their urine to see how all the organs are doing. This is where they rule things out. You know, is your cat having accidents because of a kidney issue? Is your dog not wanting to be petted because of painful arthritis? Once they've ruled out all those other medical problems and the signs from that DSHA checklist are there, then they can confidently say, okay, this is CDS. Look, getting that diagnosis can feel really heavy. I get it. But it's also the moment you get your power back. Because once you know what you're up against, you can start to fight back. And there is so much we can do to manage CDS and make sure their golden years are as good as they can be. This is your toolkit. First off, simple tweaks around the house can be a game changer. A brain with CDS really struggles with new things, so keeping a predictable routine for food, walks, and bedtime is super calming. Seriously, don't rearrange the furniture. Make their life easier with things like ramps to the couch or extra litter boxes that are easy to climb into. And keep their brain working with puzzle toys and gentle play. It really can help slow things down. Food is another one of your secret weapons. Think of it as brain fuel. Diets with lots of antioxidants and omega-3s are fantastic. And there's some really cool research on something called MCTs. You can get them from things like coconut oil. They basically provide an alternative energy source that a struggling brain can use more easily. There are also supplements like SAM that can boost awareness. And of course, there are special prescription diets made for this. This is a must-have conversation with your vet. And for some pets, medication can make a world of difference. The main one is a drug called selegiline. It's FDA approved for dogs, and it helps correct some of the chemical glitches happening in the brain. It can really help with things like sleeping through the night and remembering their house training. It's sometimes used for cats, too. The one thing to know is that you have to be patient. It can take a month or even up to 3 months to really see the full effect. So, if you only take one single thing away from all of this, let it be this. Don't wait, act early. The minute you start seeing signs, talk to your vet. The sooner you start making these changes, at home, with their food, with medication, the better your chance of slowing this disease down. This isn't just about managing symptoms. It's about protecting and preserving that amazing bond you have for as long as you possibly can. Our pets, they give us everything, don't they? All their best years, just filled with so much joy and love. So when they get to their golden years and their needs start to change, the question really just becomes, how do we give them our best in return? How do we make sure we give them everything they need, right up to the very end?